Did you know that right now, a staggering 80% of people are walking around with a nasal wall that isn't completely straight? And the wild part? Most of you watching this probably have absolutely no idea you're one of them. Welcome to this explainer. Today, we're taking a really fascinating structured tour of your very own body to uncover 14 hidden anatomical anomalies. Now, we aren't talking about diseases here, we're talking about structural quirks, little medical conditions you were likely born with or maybe developed silently that actually affect your entire life without you even realizing it.
Okay, let's dive right in by looking at a remarkably common structural quirk, the deviated nasal septum. So an overwhelming 80% of the population falls into the deviated category. That leaves just 20% with a perfectly normal straight septum. Basically, what this means is that the wall dividing your nasal cavity is off-center. And for millions of people, this is the hidden culprit behind a chronically blocked nose, severe snoring, and disrupted sleep. People spend years, sometimes literally decades, endlessly and incorrectly treating these symptoms with allergy pills and antihistamines. They never realize that the actual fix is a straightforward structural correction called a septoplasty.
To cover all the ground efficiently today, here's our agenda. We'll start with the secrets of the face and mouth, move on to the story of the neck and spine, then we'll check out chest and belly quirks, look at the structure of hands and feet, and finally wrap it all up with a final conclusion.
All right, Section 1. Secrets of the face and mouth. Expanding on our earlier point about the deviated septum, it's absolutely vital to understand the domino effect of this one hidden curve in your nose. You see, because the airway is physically obstructed on one side, you naturally compensate by mouth breathing, especially at night. And this leads to years of misdiagnosed breathing problems. Your doctor might tell you, oh, it's just seasonal allergies. But here's the thing, you simply can't medicate away a bent piece of cartilage. Only surgery can physically open that airway back up. Now, I actually want you to participate here for a second. Go ahead and pause this explainer if you need to. Go find a mirror, open your mouth, and take a look at your uvula. You know, that little dangling piece of tissue at the very back of your throat. Does it look like a single teardrop, or is it actually split into two separate sections? If it's split, well, that brilliantly illustrates our next anomaly. Between 1% and 2% of people have what's known as a bifid uvula. If yours is split, you essentially have a micro version of a cleft palate. It's a fascinating little structural quirk where the tissue just didn't quite fuse completely before you were born. But hey, here's the best part. For the vast majority of people, it goes completely unnoticed and is entirely harmless. It's just a cool secret variation in your anatomy. Dropping just below that, we find the tongue tie, medically known as ankyloglossa. This happens when the tissue right under your tongue is just a bit too short, kind of anchoring the tongue to the floor of your mouth. Now, so many adults silently struggle with unexplained dental issues, chronic sleep-breathing problems, or even really subtle speech difficulties. The thing is, they just learn to adjust to it in childhood, never once realizing that this simple, hidden tether under their tongue has actually been the real culprit all along. Moving over to the side of the head, we have a statistic that might really surprise you. Exactly 1% of people have a preauricular pit. What is that? Well, it's a tiny, practically invisible hole right in front of the upper ear. It's simply the result of incomplete tissue fusion during early development. Most of the time it does absolutely nothing, though, occasionally it can get infected. It's basically like having a microscopic dimple right on your ear. Moving on to Section 2, the story of the neck and spine. Think about the stark, physical math of forward head posture. Modern life, specifically hovering over our laptops and scrolling endlessly on our mobiles, has literally trained our bodies to adopt this position. Here is the crazy part. For every single inch your head moves forward from its normal alignment, the weight your neck has to support doubles. So if your head is 3 inches forward, your neck muscles are straining to hold up an effective weight of 40 pounds. This cascading structural failure directly results in chronic neck pain, tension headaches, and even jaw problems. All right, time for another quick self-check. Stand up and push both of your hands flat against the wall, kind of like you're doing a standing push-up. Ask someone to take a look at your back. Does one of your shoulder blades lift off your rib cage and stick out prominently? If one does stick out, you likely have a winged scapula. So many people are unfairly criticized for having lazy or bad posture when their shoulder blade protrudes like that. But honestly, the reality is far more clinical. This is typically a specific issue with the long thoracic nerve, which causes weakness in a muscle called the serratus anterior. So it's a genuine nerve and muscle anomaly, definitely not a moral failing or some lack of discipline regarding your posture. Moving further down the back, we encounter mild scoliosis. Next time you look in the mirror, check this out. Is one of your shoulders slightly higher than the other? Or does one hip dip slightly lower?
A spinal curve of 10 to 25 degrees is usually completely painless in your younger years. It's a silent curve. But it patiently waits. Decades later, that uneven weight distribution triggers mysterious, severe back and hip pain that can be incredibly difficult to track down if you don't even know the curve is there.
Next up is Section 3, Chest and Belly Quirks. Now, what's truly profound about Pectus excavatum is the frequent misinterpretation of its physical anomalies. It affects roughly 1 in 300 people. It's a structural condition where the sternum is indented, physically caving into the chest. This literally leaves less room in the chest cavity, slightly shifting the heart to the left and lowering your overall capacity for lung expansion. People with this condition often experience breathlessness during exercise and even heart palpitations. Tragically, because of these very specific symptoms, it gets incredibly frequently misdiagnosed as purely psychological anxiety, when the root cause is, well, entirely structural.
Okay, here is a number that almost always shocks people. 1 in 18. That's the ratio of people who possess a supernumerary nipple. Yeah, an extra nipple. These follow the mammalian milk line straight down the front of the torso. And because they're often quite small, patients and routinely even doctors mistake them for a common mole or a birthmark.
Moving down to the abdominal region, we find diastasis recti. If you do a crunch and see a vertical ridge bulge up right down the center of your belly, you're actually seeing the stretched tissue between your two main abdominal muscles. While highly common in women post-pregnancy, it also occurs really frequently in men too. The absolutely crucial takeaway here is that standard abdominal exercises, like your traditional sit-ups, actually force those muscles further apart, worsening the condition instead of fixing it.
All right, let's head down to Section 4, Structure of Hands and Feet.
Did you know nearly 1/3 of the population, around 30%, is walking around with flat feet or fallen arches? Think about your feet as the literal foundation of a building. When that foundation drops, every single step you take sends the wrong mechanical pressure traveling all the way up your entire skeleton.
So the really crucial point here is understanding this domino effect. A prime example is unequal leg length. Having one leg up to 2 centimeters shorter than the other is incredibly common. But think about what happens. Your hip drops with every single step to compensate. That changes your foot pressure, which then causes shin splints, which leads to knee pain and ultimately results in lifelong hip and lower back pain. All of that mysterious agony is often just a simple structural math problem that can literally be fixed by placing a basic lift right inside your shoe.
I want you to look down at your feet right now. Seriously, go ahead. Look at your toes. Is your second toe, the one right next to your big toe, noticeably longer than the big toe itself?
Well, if it is, you have what's called Morton's toe. It's an anomaly shared by 10 to 30% of people. Because that second toe is longer, it dramatically shifts your weight distribution when you walk, acting as a major contributor to calluses, bunions, and even lower back pain. And hey, while we're talking about digits, let's take a quick look at the hands. About 10% of people have Clinodactyly. It's a genetic trait that visually bends the pinky finger inward toward the ring finger. It's completely harmless for sure, just a fascinating aesthetic bend that tends to run in families.
And that brings us to Section 5, Final Conclusion.
So, what we've discovered today is that our bodies are wonderfully weird, structurally imperfect machines. What we often perceive as personal flaws, bad posture, or mysterious aches are actually just built-in anatomical quirks. So, I'll leave you with this. How many of these 14 anomalies did you count in yourself today? Drop your number in the comments below. And if this explainer blew your mind, or maybe finally explained that weird ache you've always had, share it with your friends to see what hidden quirks are operating inside their own bodies. Keep exploring, and I'll see you next time.